All right, today we're going to dive into something that tells a really fascinating story about your health. We are decoding your white blood cell count. You know that feeling? You get your blood test results back, that CBC, or complete blood count, and you're staring at this list of words like neutrophils, lymphocytes, monocytes, and you're just kind of left scratching your head. It seriously feels like trying to read a whole different language. Well, if that's you, you are in exactly the right place. We are going to make sense of all of it. We're going to meet the team, your body's very own microscopic army, and you'll understand exactly what each of these soldiers does to keep you healthy and safe. So, here's the game plan. We'll start with the big picture, the total size of your immune army. Then, we'll meet the different squads one by one, the first responders, the specialist units, the all-important cleanup crew, and finally, the elite memory cells. First up, let's talk about the total white blood cell count, or WBC count. The easiest way to think about this is like a commander doing a roll call. It's the total number of defense units you have on active duty at any given moment. So what exactly are they? Well, white blood cells are basically your body's mobile defense force. They're the guardians cruising through your bloodstream, constantly on patrol and ready to fight off anything that doesn't belong. Bacteria, viruses, you name it, all to protect you from getting sick. And this is the magic number you'll see on that lab report. For a healthy adult, the normal range is usually somewhere between 4,500 and 11,000 cells per microliter. This little number tells us if your army is at full strength. If the count is way outside this range, that's the first major clue for your doctor that something's up. Okay, now let's meet the individual soldiers. And we have to start with the most numerous ones in this army. These are your neutrophils, and they are the absolute first responders on the scene of any trouble. Neutrophils are the infantry. They are the foot soldiers who just swarm to the front lines the second an invader is detected, especially bacteria. Their main job is to literally eat and destroy these threats. It's a process called phagocytosis. They are aggressive, they are super effective, and they are absolutely critical. And just look at their numbers. It's staggering. Neutrophils make up a whopping 50 to 70% of your entire white blood cell army. I mean, they are by far the largest division. And that just tells you how important that rapid initial response really is to your body. So, what does it mean when these numbers change? Well, a high neutrophil count, that's called leukocytosis, is a huge signal that your army is in the middle of a big fight, usually against a bacterial infection. On the flip side, a low count, leukopenia, might mean your forces are stretched thin, maybe because of a virus or even certain medications. Now, while the neutrophils are handling the main invasion, your body also has these specialist units for more unique threats. They're much smaller in number, but trust me, their jobs are super specific and incredibly important. Let's meet the eosinophils and basophils. Eosinophils, think of them as the special forces team. They're trained for very specific missions. Their two main targets, parasitic worms, which are way too big for neutrophils to handle, and also calming down the inflammation from allergic reactions. And then you've got the basophils. These guys are the alarm system. They might be the rarest of all the white blood cells, but wow, do they pack a punch. When they spot an allergen, they're the ones that hit the big red button, releasing chemicals like histamine that cause all the sneezing, itching, and swelling we know and love from allergies. So it makes sense that if a blood test shows a spike in these two specialist units, doctors immediately start looking for a few key culprits. High eosinophil or basophil counts are classic signs of things like allergies, asthma, or an ongoing battle with a parasite. All right, after any big battle, there's always a mess to clean up, right? Well, your body's no different. And that's where our next unit comes in. Let's talk about the official cleanup crew, the monocytes. Monocytes are the giants of the white blood cell world. They are literally the sanitation engineers of your body. Think of them as giant vacuum cleaners patrolling your bloodstream and tissues, gobbling up dead cells, debris, and any leftover enemies after a fight. They keep your internal environment spick and span. Now, if you look at the numbers, you'll see they aren't a huge part of the army, just about 4 to 6%. They're certainly not the main fighting force like neutrophils are, but their role in cleanup and maintenance, absolutely critical for a healthy immune system. Now, an elevated monocyte count, or monocytosis, often points to a different kind of problem. While high neutrophils suggest a short, intense battle, high monocytes are often a sign of a long-term chronic fight. We're talking things like persistent infections, autoimmune diseases, or even certain cancers. And finally, we get to the most sophisticated, most strategic branch of this entire army. These are the intelligence agents, the veterans, the memory cells. These are the lymphocytes. Lymphocytes are just incredible. They are your adaptive immune system. You've got two main types: B cells, which are like tiny weapons factories that build custom antibodies to tag invaders for destruction, and then T cells, who act as assassins, hunting down and destroying your body's own cells that have been infected. And the most amazing part? They remember every single enemy they've ever defeated. Their whole strategy is this brilliant four-step mission: identify, attack, and remember. First, they identify a very specific invader. Then, they create a custom-tailored attack plan. After they destroy the threat, they create memory cells. And this is so important because it guarantees that if that same bad guy ever shows up again, the response will be immediate and totally overwhelming. This is the whole principle behind immunity and how vaccines work. So, here's the key takeaway. When you're looking at that blood report, a high lymphocyte count is the classic signature of your body fighting a virus. Remember, neutrophils spike for bacteria, lymphocytes surge for viruses like the flu or mono. A low count, on the other hand, can sometimes point to a weakened immune system. And here it is, the whole shebang, all in one place. This is your immune army roster, a perfect little cheat sheet. You've got your neutrophil, first responders, making up most of the force to fight bacteria, the lymphocyte memory cells, your second in command, handling viruses, and then the smaller specialized crews, the monocyte cleanup crew, and the eosinophil and basophil specialist units for allergies and parasites. Each one has its own crucial role. So the next time you see a CBC report, don't just see a list of confusing words and numbers. See it for what it truly is: a dynamic, real-time dispatch from the front lines of your health. It's a story of battles being fought, of constant surveillance, and of an incredible microscopic army working 24/7 just to protect you. The only question is, what story is your body telling today?